Hi everybody, I'm Dr. Michael Duchynski. I'm the medical director here at Summit Urgent Care, and today I want to talk to you about how to safely get your workforce back into your place of business in this coronavirus pandemic. One of the things we've noticed is we've been getting contacted by a lot of our employer clients asking about fever checks, both helping them with implementing fever checks or staffing fever checks. And I did want to talk a little bit about fever checks and their role in screening potentially infectious employees out of the workplace. The problem with fever checks, while they're definitely part of a good screening process, is that they don't screen out a large proportion of sick patients. And so when we look at a cohort of, say, 10 employees coming back to your place of business, and for argument's sake, we say 5 of them are infected here, these guys on top, when you're doing fever checks, you're probably only catching this first guy right here. The reason being is that a large proportion of patients who develop coronavirus symptoms actually will not have fever in the beginning. And so by the time they develop fever, which is usually a few days in, they've actually been shedding virus. And what that means is that they can infect people around them. So even without fever, they could be infecting people around them. And that's why our fever check has let in, fever check alone has let in 4 potentially infectious people in your group of 9 that are still coming in. What Summit recommends is really adding a second layer of screening to that. So we continue to do the fever checks, and then we add in a second level, which is essentially a screening questions, really asking about symptoms of coronavirus. What that essentially does is catches those people who potentially have symptoms that aren't fever related and kind of knocks those people out of getting into the building. And these people that have screened out, they're going to need to be seen by a provider, and they certainly can come here to Summit and we'll take care of them. They may need testing, and we can do those things as well too. What you'll notice is that, well, I've completed 2 levels of screening and I still got this one guy here who might be infected that's going to come in and sort of put these other 5 healthy people at risk. Well, the reason for that is that this patient, like a good percentage, maybe even up to 20% of patients with coronavirus, is asymptomatic. And what that means is he doesn't have any symptoms, but he's shedding virus. So he can infect other people, but he's got no symptoms at all. And so these are the ones that you can't screen out because there's just nothing to really ask them. And so what ends up happening is the best way to protect yourself once they get in here with this healthy group is to use good personal protective equipment, masks, gloves, those types of things. What that ends up doing is helping to reduce the exposure risk of this potentially asymptomatic carrier getting into your business. We would, here at Summit, we really would like to be able to help you guys get back to kind of business as usual, so to speak. And we want to use our experience in developing our own SOP as we've kind of worked through this pandemic and had patients both sick and with injuries coming into the clinic. To, the things that we've done to help protect our staff and those patients really has helped reduce our exposure risk almost to 0. We really haven't had any hits to our labor force over the past few month to several weeks since implementing this kind of full SOP. And we'd really like to use that experience to help you guys get your workforce safely back in and protect them while they're working within the buildings of or within the confines of your business. If you'd like us to help you, please contact us. You'll find our contact information either above or below this post. Please reach out because we really would love to help you guys get back to doing business as normal. Thank you and have a good day.